Hi, this is the feedback session for Module 3. So last week we discussed, among other things, the touch points. And the touch points are objective descriptions of current interactions the patient has with the different stakeholders. This week we will add the emotions of the patient and also your subjective interpretation of the different interactions and the emotions of the patient. So first, to go back to last week, because there was a question about it, a good question. So last week I indicated that the touch points should be described objectively. And then I got a question, or we got a question, if your research question is not, if your research question addresses the emotions of the patients, why shouldn't you also put emotions in your touch points? So in this case, for example, the research question was, what makes the patient feel heard and feel cared for until complete recovery? A good question, but still try to make your touch point as objective and objective descriptions of the current situation. Because in the next phases, so now in the emotion line, but also when you're going to describe the behavior and your own insights as a designer, then you can add your subjective and emotional load to these interaction points. And also because if you already describe them now, for example, that the doctor listens carefully to the patient, that's already a kind of a solution, and it doesn't have to be the current situation yet. So keep your solution, the way of thinking, out of the touch points, but make it an objective description of the interactions there. So that having said, this week one of the things was to add the emotion line of the patients. And I have an example here. Well, I take another example. I take this one. So an example here. So here the emotions of the patients are mapped through the different stages and sub-stages. Like the patient is annoyed, worried, here hopeful, so it's going up again. One thing that's very well done here is that quotes of the patients are also used to illustrate the different emotions. One thing that is missing here is the emotion line. So by drawing a line, it will be clear, more clear in a visual way, through its stages the patient goes.
Yeah, and I have an example where the participants have this goal curve line added to the emotions. So you see this here. So it's give you already a visual hint and visual overview how these emotions are changing throughout the different stages. Using this example, I would like to also highlight one important point is the alignment, and more the vertical alignment you can say between, for example, the sub-stages, the emotions, behavior, and insights. And for example, in this example, the medication, taking medication is defined as a sub-stage. And the patient's emotions is relief. So most probably patient feels relief that she or he can use medication for the pain. And the behavior, which is described here, understanding how the medication will help with goal and introducing the changes into the patient condition. So this is the behavior. And the insight, which is described here, this phase calls for education, the patient, a patient's health condition and medication adherence, for example. So they are very well aligned. So it's about the medication, that's the stage, and then the emotion, which is playing an important role in that stage. What is the corresponding behavior of the patient, and what are the insights that you have collected as a researcher, as a designer from this information. So an alignment of these are important. Another point that I would like to highlight here is the definition, or how well you can define the substages. And this is in this example, the participant defined the substages very well. And especially I would like to highlight one of the substages, and that's the diet and lifestyle. Because in the movie, in the healthcare specialist explaining about gout, explained that the diet and lifestyle was a very important part of the health condition of the patient. So it's very smart that the participant add that as a specific substage into it, because it's an important part of the health journey of the patient. So you can also look in this way to the substages and defining more specifically, and make it more meaningful for the patient journey. I have one other example, and that is this one. As said, this is the substages are less specific defined here, so I think that will improve your understanding of the journey to doing so. What I like here is the insights, and I would like to pinpoint how you best can describe the insights. For example, here one of the insights is expectation management is important. And I think this is a very nice and especially workable insight into the ideation phase, which will start next week. Because it lends itself to ask certain questions, and then the most famous one is the what, the why, and who. Try to describe your insights in such a way that you it's suitable to start your ideation with. For example, here in the phase of surgery, the participants' insights write down what's the surgeon like. And this is, I think, less usable and workable to start your ideation with. Yes, I think that was.
So in the coming week, you will start your ideation, I think, already for you. And you will translate all the things that you found until now into design opportunities. So we are looking forward to receive this in the coming days, and wish you all of luck. See you next week.
See you next week.